In a highly desirable world, hinging on some utopic idea, women would probably have been able to bridge the gender wage gap in workplaces.
Maybe our external appearance wouldn't be so important, and perhaps some medical conditions wouldn't have been so prejudiced against us.
But life cannot just be layers of what we conjure in our imaginations. It isn't always a working woman's Shangri-La, or our wives, mothers, sisters, or aunts' health ambitions.
In fact, there are certain health issues that affect women exclusively. Issues such as menopause, postpartum depression, uterine fibroids, and miscarriage. But understanding women's health concerns is the first step towards taking control of our own well-being.
Uterine fibroids are benign tumors of the uterus. That's in medical terms. In layman terms, they are masses that grow on the uterus or on the womb of a woman, and they can grow to various sizes. You can have one, you can have multiple. And the most important thing patients tend to ask is, are these cancerous? So benign means it's not cancerous.
Medical experts will tell you that the root causes may not be so clear, but there are certain factors that are most likely to account for this issue impacting women.
We believe a lot of women who have it actually do because of genetics. So if your mother or your sister or you have a strong family history of uterine fibroids, it's quite likely that you're at risk of having uterine fibroids as well. We also believe that they tend to pop up more so when your hormones are very active. So that's why it presents in those patients in their reproductive age. So once you get to your 20s, 30s, 40s, that's when you would expect fibroids to start to show up. It may be occurring in response to your diet. So if you have a poor diet, high in red meat, highly processed foods, very little fruits and vegetables, we believe that that impacts on the presence of fibroids and definitely the growth of fibroids.
Meet Raquel Bailey, whose unfortunate journey with uterine fibroids lasted for almost 9 years.
I was around 27, touching 28, and I went for my regular female checkup. When they did the ultrasound, they said everything was fine, but there was a point that he could not see beyond. So he decided to go do it vaginally. And that's when he found the fibroid on top of my uterus. I was saying to myself, it's hard. I'm not sure if I can get pregnant with it. I was worried about conception, of course, and I was worried about if it is cancerous or anything, because at that point I wasn't sure what fibroids was. I knew it ran in my family, but back then they didn't call it fibroids. My tummy began to grow, especially the top part, since it was resting on top, so my tummy began to protrude. And of course, when I had my period, the pain was severe. I had, to the point that I even had to lie on the floor to get a little bit of relief from it. Yeah, my clothes couldn't fit much because of the tummy hanging over.
The symptoms occur dependent on the size of the fibroids, the location of the fibroids, and also dependent on what else is happening to the patient otherwise, right? So common symptoms related to size are, if the fibroids are very big, then the woman looks as if she looks pregnant. So she notices that her tummy is growing, the waist of the clothes start to fit her a bit differently. She might start to have what we call compressive symptoms. Based on the location of the uterus, it can press on the bladder, which is in the front, and that's where your urine is. So you might find that you're complaining of more frequent urination. You're going to the bathroom to pee all the time, right? Another thing is that your bowel is at the back, behind your uterus, so you may get constipated. Again, because your nerves come from behind, from the spine backwards, then you can also have compressive symptoms on nerves around there, and some patients come with back pain. Because it is close to where the blood vessels go down into our legs and the nerves go down into our legs, some people complain about pain radiating all the way down to their legs as well as swelling. If the fibroids are on the inner side of the uterus or within the muscle of the uterus, that's where your period comes from now. So those patients tend to complain about heavy bleeding. Bleeding that is lasting more than a week, more than the average period. They're soaking through pads in an hour, in 2 hours, messing up themselves, right? That causes a lot of social embarrassment. Not only that, but if you're bleeding that heavily, then you start to get symptoms of anemia. So you start to feel weak, dizzy, you might actually faint. Another symptom that patients can present with is pain. So if the fibroids grow to a certain size, then they start to outgrow the blood supply that comes from outer to inner. And sometimes they can, what we call, degenerate, and that causes patients to have a lot of pain.
I got married, and my husband and I spoke, and I said to him, all right, I don't want to do the surgery, have any surgical procedure done on me, just in case that they found more and they had to take out the entire thing. So I wanted to try and conceive before doing the myomectomy. Then I got pregnant in the February of 2021. That's when the fibroids became aggressive. It grew and it grew and it grew. I looked so much like I was full-term pregnancy when I was only 4 months pregnant. So it was very aggressive. I was really sick in the first part of the pregnancy. So much so that I was labeled a high-risk patient. After having my baby, I went to the doctor to do my regular checkup. And Dr. Madam was saying to us when we decided to take out the fibroids. So I told her we were waiting on her. She said, no man, the decision is yours. So I said to her, all right, maybe we can do it now. I was there touching my tummy. Because when I went in, it was huge, huge. It was like a full baby. It was the size, the fiber was the size of a basketball. It was, yeah, and there were 3 others. So it was 4 fibroids. And she took it out, and when she took it out, she said everything went well, and my uterus, it's healthy. That's the word she used. The best part of my journey having fibroids is hearing that there are treatment options available.
So fibroids can be treated in a number of different ways, but really and truly treatment should be aimed at the patient's symptoms as well as what their future fertility desires are. Now, if you are having bleeding problems and the size of the fibroid is not significant, then we can entertain giving you medical management to try and maintain the bleeding to a level that is acceptable. So sometimes that involves using tablets. There are some NSAIDs that we use for that. There are hormonal tablets that we can use. There's also the hormonal injection that we can use to help to reduce the amount of bleeding that you are having. If it is that you are having a problem with pain and size, then that's where surgery comes in. A lot of the patients ask, boy doc, I don't really want to do surgery. I'm not ready to do surgery. And they ask if there's anything that can be used to shrink the fibroids. There are medications out there that have been used to shrink fibroids, but they don't maintain the fibroid at that size for the rest of your life. And they can only be used for a short period. If they are not so large but they are plentiful and they're causing you significant symptoms like your blood count is really low, you're frequently missing work, it really interrupts with your daily living, then we would recommend doing surgery. And surgery involves either removing the fibroids only, or we can remove the uterus in total. Now that decision is a big decision. If you have finished having your children, you don't want to have any more kids, then clearly removing your uterus is okay.
What I learned coming out of this entire experience is that I should not be afraid of my doctor, all right, or doctors in general. The gynecologists, they are there to help you. Visit them, have an annual or your regular routine checkup. It is to ensure that you have a healthy life.